Hi, I'm making this video regarding misunderstandings of mental illness, which particularly bipolar and schizoaffective disorder and depression. I currently have bipolar disorder, depressive type, and schizoaffective disorder. I have post-traumatic stress disorder as well as an anxiety disorder, and I also have a seizure disorder. I am talking to everyone today because it's come to my attention regarding my family and one of my very best friends who've excluded me from their life because of the symptoms that I have been having. I'm 43 years old. I was diagnosed with bipolar or manic depression when I was 16 years old. I've been suffering from this type of disorder for quite some time, even as a child, which was misdiagnosed or misunderstood and not known what was going on with me. I was abused as a child, sexually abused, ended up being raised by other family members, which were also abusive as well. They say a lot of the times this is what initiates this disorder or the chemical imbalance in your brain. I am making this video because I want to make it straight to everyone that it's not something that people with bipolar or schizoaffective disorder or anxiety disorder consciously make a decision to be depressed or to have anxiety or to have a psychotic episode. It's a part of our diagnosis. Yes, there are therapies. Yes, there are medications that we can take to kind of help stabilize those situations, but that does not always mean that those are going to work. I myself have been on over 45 different medications, and I am also allergic to antidepressants, which cause me to have seizures. I have lost many jobs. I have difficulty keeping jobs. I have been told that I have been lazy, that I am unstable, that I am not a person that cares about themselves or loves themselves, or that I am not purposely living life because I am putting on this facade. This is not a life that I have chosen. Trust me. I have accomplished a lot in my life. I have been a nurse for 20 years. I have won awards, mostly in my manic states, that I have gone for long periods of times with elation, creativity. I'm artistic. I have made a lot of accomplishments, created a lot of programs that have been used throughout the United States by different companies to make personal improvements in nursing facilities and in wound care. And those are the things that I'm very proud of. And yes, there are times where I kept jobs for a very long time, 7 years even at that time. I have been a self-injurer since I was 16 years old. Cut myself up and down my arms, legs, things like that. Also been told that was because of attention seeking. That is not what self-injurers do. They do that because, and like myself, it's because it's a release. You have so much pinned up anger towards yourself. You have so much pinned up emotions towards yourself that when that euphoria of cutting yourself comes over you, it's as if it helps relieve that emotion, especially when you don't have anyone to talk to. And I think that's one of the biggest issues is the stigma behind having bipolar, the stigma behind having schizoaffective disorder. That person wants to keep that inside because there is such a stigma behind that. Who wants to be around someone with bipolar? Oh my God, they must be crazy. But what you don't realize is that on a daily basis, there could be someone that's in your family a friend of yours, a coworker of yours that has schizoaffective disorder or bipolar disorder, and you have no idea, and they are living and doing just fine. On the other hand, there are people like myself who did do well for quite some time and have fallen out and have not been able to truly come back to stabilization. My doctors at this point have me on medication that they really don't know what else to do. I have had electric shock therapy because of my deep depression. I can go days without taking showers. I can sleep on days on end. There are times that I have lost a job because I had psychosis, that I believed I saw things. I've had at least 8 hospitalizations since probably 2008, and it's 2015 now. I recently lost a really good friend, and this is one of the reasons why I'm making this video, is because you get to the point where you have that one person that you can talk to. You have that one person that you believe that can understand you. And no one, unless you are the person who has this disorder, and I want to stress that, you will never understand what it's like to feel the way we do. You will never understand how hard it is to get out of bed. You will never understand how much anxiety you have to try to think, oh my God, I have to go to work today, and all these things are going in your mind, and you're thinking, I'm not going to succeed. I can't get there. I can't get out the door. I can't get dressed. I can't drive in this car. I'm having a panic attack going down the highway. Oh my God, what am I going to do? I feel like I'm going to die. You just have no idea what people like us go through. And I want to put the education out there, particularly friends and family, who do find out, oh, my family member has bipolar. Oh, I heard they had psychosis and they had to go in the hospital. Well, then they get on medication, they get stabilized, they get better. But you know what? They never forget the fact was that, hey, at one point, they were psychotic. Hey, they had a bipolar episode. Hey, they tried to commit suicide at one time. I don't want them around my children. I don't want them around my family. I don't want them around your child. I don't want them to be best friends. I don't want them to be your friend. I don't want to be your friend. I can't take it anymore because I can't see you being this way anymore. I just lost a friend because she was sick and tired of seeing me make mistake after mistake after mistake. She doesn't understand that I do try to make efforts to keep a job. It gets to the point where, if I'm at a job and I'm having anxiety or an episode, I'm no good at this job. I'm a nurse. I'm not helping people. I am going to be making mistakes. Your train of thought gets slower. Your understanding of things gets slower. You're going to make mistakes. And if you're dealing with people's lives, that is not a good thing. And this is the only job and the only profession that I know. So at this point, I have not applied for disability. I don't want to apply for disability. I want to continue to try to work on myself. I want to continue to try to get a job. At this point, I do, and just recently got a job working as needed. It's called PRN. And so far, it is working out. I choose the days that I want to work. The days that I know that I'm having bad days, I don't go to work. And I don't get penalized for it. Great, yeah, that's wonderful. I don't have benefits though. I don't get insurance. I have a child that is 9 years old, and because of my disorder, I haven't seen him maybe 4 times in the last 5 years because I can't handle the anxiety of it. I have to pay child support. I'm behind on child support. I can't keep a job. These are the things that people with disabilities and mental issues have to go through on a daily basis. Another thing is, I had a coworker the other day sitting there telling me how crazy she had to deal with a patient who had bipolar and schizoaffective disorder, and how this schizoaffective disorder person was absolutely insane, and that she hated dealing with schizoaffective people, when the whole time she didn't even realize that I have schizoaffective disorder and I'm sitting right next to her, and she has total respect for me as a professional. I just wanted to let everyone know that just because a person is not, or seems to be lazy, or not consistent in their life, or having constant relationship problems, or their family doesn't understand, we need somebody to listen. We don't need necessarily someone to say, hey, I want to solve your problem, because it's not going to happen. We can't even solve our own problems. Our therapists can't even solve our own problems. So I guess my point is, also out in the media, people hear, oh, this person shot up 5 different people. Oh, well, it turns out they have bipolar. Or it turns out they have schizophrenia. True, maybe that had a lot of contributions to that person doing that. But that doesn't mean that everybody that has bipolar and everybody that has schizophrenia or schizoaffective disorder is going to go around shooting or killing people. I have never once in my entire life had any kind of thought of hurting someone. I've thought about hurting myself. I have attempted suicide several times, but I've never, ever thought about hurting anyone else. So these are different situations for different people. So I really feel like the stigma needs to be controlled. And my heart just goes out because the loneliness is so horrible. And that just makes the depression worse and the depression worse, and it turns into psychosis. People need to be there for other people. People need to be understanding of and look into what are these diagnoses. Read up on the definitions. Understand the person that you're dealing with, that they have got a past, that they are alive, that they are a real person. They are not someone that can just go to work every day and have a simple life, or have a simple relationship. They are trying every single day. It is a struggle every single day. And I just want everyone to know that I am trying every day of my life to be a better person, to make sure that my family understands, which at this point they do not. They do not want to have anything to do with me. And I am very sad because they're the only people in my life. I have no friends. I had one friend that just recently just was fed up with me. She put and invested herself too much into me. And I didn't whine to her all the time. We talked a lot about other stuff. We went places, we went to the movies, we did stuff. I mean, I was a part of her children. My daughter was with her children. We went to the pool, we went shopping, we went to the mall, we went to the movies. We did all the things that every normal person does. But, you know, she invested herself and got too upset because she sees me making multiple mistakes, so she decided she didn't want to be my friend anymore. This is not something that I can control. She was like a sister to me. And I don't know if I'll ever get her friendship back. So I want everyone to know how important it is to please understand, at least try to make an investment and look and learn and see people who they are, and not assume by their diagnosis and stigmatize people. Thank you for listening.